A warm hello to lovely ladies on the other side of the world. I am Dr. Suganya. I'm a consultant in obstetrics and gynecology. I've specialized in IVF and reproductive medicine. I currently work in Coimbatore. And first of all, thank you for giving me such a wonderful opportunity. Women's health in the topic, it is something that is not really spoken about, the depth of it. So they generally tell you that a woman has to be healthy, happy, but what exactly is women's health? It is just not about the physical health. There are so many other things that cover the aspects of women's health. So I'm going to take some 10 minutes and I'm going to explain about the various aspects of women's health in this small platform. So நான் இந்த டாக் பார்த்தீங்கன்னா 3 பார்ட்ஸாக டிவைட் பண்ணியிருக்கேன். ஒன்று வந்து ஃபிசிக்கல் ஹெல்த், ஒன்று மென்டல் ஹெல்த் அண்ட் ஒன்று சோஷியல் ஹெல்த். இப்போ ஃபிசிக்கல் ஹெல்த் அப்படின்னு சொல்லி பார்த்தா ஜென்ரலி வென் யூ லுக் எட் அ பர்சன், அவங்க பார்க்குறதுக்கு வந்துட்டு ஒல்லியாக இருக்காங்க, இல்லை அவங்க பார்க்குறதுக்கு வந்து ஹெல்த்தியாக தெரியுறாங்க, ஸோ தே ப்ராபப்ளி ஹெல்த்தி அப்படின்னு சொல்லி நீங்கள் சொல்லலாம். பட் ஆனஸ்ட்லி ஹெல்த் இஸ் a topic that involves not only the physical outlook or the characteristics of a person, but also the mental aspect of a person. And also physically in சொல்லி பார்த்தீங்க அப்படின்னா it's just not the absence of a disease. They can still be disease free but still be unhealthy. So healthன்றது வந்து it's 3 things: physical, mental and social. Since this is about women's health and we are talking about women here, I would like to mention a little about how the uterus works and what is abnormal, what is normal. So uterus in a it's an organ, it's a female reproductive organ, and uterus oda rendu sides you have tubes and 2 ovaries on either sides. So in the rendu ovaries da vandu pathina produces hormones. So நீங்க இப்போ menopause attain பண்றீங்க அப்படினா கூட your uterus may not work, as in bleeding la நடக்காம இருக்கலாம், but sometimes ஒரு minimal amount of hormones can keep secreting in your ovaries and the perimenopausal period la. And ovaries la vandu da eggs produce agum, you know, where the eggs that is required for fertilization to take place. So இப்போ periods oda day 2 day 3 பாத்தீங்கன்னா ஒரு சில follicles recruit ஆகும். These follicles are baskets that contain the egg. So in the follicles vandu they grow in size over the cycle. Day 14-15 ஆகும்போது they rupture, releasing a mature egg outside. So if fertilization doesn't happen in the tubes, then you end up with menses every cycle. In case it gets fertilized and the embryo implants into your uterus, you become pregnant. So what is a normal period and what is an abnormal period? இப்போ normal period அப்படின்னா ஒரு 21 to 35 days cycle is considered a normal period. So உங்களுக்கு every 20 days வருது, every 15 days வருது, lots of spotting throughout the cycle, or you're getting cycle only once in 2-3 months, and some people get only menses when they take tablets. இந்த மாதிரிலாம் இருந்துச்சுன்னா there is probably something wrong with your uterus or your ovaries or some other general hormonal imbalance as well. இந்த மாதிரி இருந்தால் தான் irregular periods வரும். ஸோ இந்த மாதிரி இருக்குன்னா please go and have a consultation with your doctor. Do not ignore the symptoms. But at the same time every ஒரு மாதம் 22 வருது, ஒரு மாதம் 23 வருது, ஒரு மாதம் 26 வருதுன்னா it's absolutely normal. As I said, every 21 to 35 days is considered a normal period. Now coming to pain during menses. So இப்போ normally பார்த்தீங்கன்னா a lot of women experience pain on day 1 and probably day 2 also of period, which is okay. But if ever you have pain even before a cycle, ஒரு சைக்கிள் ஸ்டார்ட் பண்ணுறதுக்கு முன்னாடியே பெயின் ஸ்டார்ட் ஆகிடுது, த்ரூ அவுட் த சைக்கிள் இருக்குது, பீரியட்ஸ் முடிஞ்சதுக்கப்புறமும் பெயின் இருக்குது, இந்த மாதிரிலாம் இருக்குது அப்படின்னா you probably have some other lesion inside your uterus. So it's time for you to go meet the doctor. And also the flow. What is normal? Now, around or average of 30 to 40 ml is considered a normal flow during menses. So anything more than 80 ml is abnormal and anything less than 20 ml is again a scanty flow. So இப்போ ஒரு pad எடுத்துட்டிங்கன்னா sanitary napkin that can store, or average sized medium sized sanitary napkin can store up to 5 ml of blood. So you can calculate accordingly. And also இப்போ currently menstrual cups are in use. I'm pretty sure a lot of you will be using it. Menstrual cups oda ஒரு biggest advantage enna, you can measure the blood flow during every cycle. that will give you a rough idea whether you're bleeding too much, too little, or if it's normal. And if ever you have increased amount of bleeding, a lot of clots அப்படினா, it means that உங்களோட thickness of the uterus is getting thicker due to some reason and you have to go see your doctor. And then now coming to the common lesions, the common gynecological diseases that you can see. So நீங்கள் கேள்விப்பட்டிருப்பீங்க fibroid uterus, PCOD, endometriosis, adenomyosis, these are all very common, more common than you think. I would like to put a spotlight on endometriosis mainly because இந்த ஒரு diseaseக்கு வந்து அவ்வளோ awareness இல்லை. And also it is a disease that is often diagnosed very late, because one of the main symptoms of endometriosis is painful bleeding. So periods of pain irundha, we assume that it's probably okay, normal bleeding, I don't really have to worry about it, ninga vittirலாம். But there can also be an endometriosis. So உங்களுக்கு ரொம்ப heavy menses இருக்கு, ஒரு day to day activities கூட பண்ண முடியல, இல்லை பீரியட்ஸ்க்கு முன்னாடி பீரியட்ஸ்க்கு அப்புறம் இந்த மாதிரிலாம் இருக்குன்னா, ப்ளீஸ் கோ அண்ட் செக் யூர் செல்ஃப் ஃபார் endometriosis. Early stages of endometriosis cannot be diagnosed with scans, but still go talk to your gynec doctor and discuss about it. So endometriosis, what is the lesion is, இப்போ யூட்ரஸ் பார்த்தீங்கன்னா 3 layers இருக்குது, inner, middle and outer layer. இந்த innermost layer தான் வந்து every cycle உங்களுக்கு திக்காய் bleed ஆகணும். But if this layer is seen in the other parts of outside the uterus, டியூப்ஸில், ஓவரீஸில், அப்டமனில், இந்த மாதிரிலாம் இருந்ததுன்னா என்ன ஆகும்னா, உங்களுக்கு எவ்ரி சைக்கிள் அப்போ அங்கேயும் ஹார்மோனல் சேஞ்சஸ் நடக்கும். அண்ட் யூ எண்ட் அப் ஸ்பாட்டிங் there is no way the blood can come out, because again there is no outlet. யூட்ரஸ்னா வெஜைனா இருக்குது, வெளியில் வந்துடுது, பட் இன்சைட் அப்டமன் there is no outlet. So what happens is உள்ள உங்களுக்கு வந்து சிவியர் கன்ஜஷன், சிவியர் பெயின் வர ஆரம்பிக்கும். There is another similar entity called as adenomyosis, where அந்த one layer of uterusல இல்லாமல் மீதி 2 லேயரில் இருக்கும் in the deposits. So every time you bleed, your uterus becomes bigger and bigger and bigger and bulky. So this is a bulky uterus. So in the மாதிரி இருந்தாலும் you will probably need small injections, medicines, or even an intrauterine device that is loaded with progesterone. So இது ரெண்டும் வந்து less spoken about, that is the reason I wanted to bring an awareness to it. And PCOD கேள்விப்பட்டிருப்பீங்க, polycystic ovarian disease, which is very common, 1 in 10 women are affected. ஸோ இப்போ நிறைய ஆக்னே இருக்குது, irregular cycles இருக்குது, rapid weight gain இருக்குது, mood swings இருக்குது, you have hair developing on your upper lip, on your face, on your chest, இல்லை hair fall, இந்த மாதிரிலாம் இருக்குது அப்படின்னா வந்து you probably have a PCO and irregular cycles of course. So again a doctor will help you find out. இப்போ PCODக்கு வந்து very simple management, it is just weight loss and going on a healthy lifestyle. That is the first line of management, and of course அதை மீறி கொஞ்சம் கூட டேப்லெட்ஸ்லாம் இருக்குது. So I'll be talking about the lifestyle in the upcoming few minutes. So irregular periods, you can always think about endometriosis, adenomyosis, fibroids. Fibroids is a small growth inside and outside the uterus, which is not cancer, and they can be removed. ரொம்ப சிம்டமேட்டிக்காக இருக்குது, ரொம்ப பெயின் இருக்குது, யூரின் போகும்போது கஷ்டமாக இருக்குது, அந்த மாதிரிலாம் the doctor can help you remove it. Otherwise it really doesn't cause no harm, because all these diseases shrink during menopause when the hormones are deficient. And now coming to vaginal discharges. So what is a normal vaginal discharge? Is a fluid white discharge up to 1 to 2 teaspoons a day is considered normal. இது வந்து உங்கள் பீரியட்ஸ்க்கு முன்னாடி egg develop ஆகிற அந்த ovulation டைமில், or when you're feeding the child, or even in pregnancy, naturally this will increase, which is again considered normal. But if the discharge is curdy, ஒரு மாதிரி தயிர் மாதிரி இருக்குது, it's smelly, foul smelling, and you have a lot of itching and rashes, or the fluid is yellow in color or green in color, இந்த மாதிரிலாம் இருக்குன்னா you'll have to go and check with your doctor. He or she will prescribe you some antibiotics. So that is about the vaginal discharge. Otherwise in simple discharge பற்றி ரொம்ப பயந்துக்காதீங்க. And now another very important thing is cervical cancer vaccine. So if you have children or male and female, boy or girl, between the age of 9 to 14 years, please have them vaccinated. இது ஒரு simple shot தான், it's a 2-dose vaccine for children between 9 to 14 years. Above 14 years, it's a 3-dose vaccine. So 0 months, 1 to 2 months and 6 months. It's a very simple vaccine. Anyone should be able to give you, any gynecologist should be able to give you. So, a lot of people ask, okay, எவ்வளோ நாள் வரைக்கும் இந்த vaccine எடுக்கலாம் அப்படின்னு சொல்லிட்டு. இப்போ 45 years வரைக்குமே it is advisable to take it, but if you've had a sexual intercourse and you're exposed to it and the 2 different strains of the virus now, the efficiency of the vaccine will not be that good, but you can still take it up to 45 years of age. So please make sure your children and you take this vaccine. இன்னொன்று வந்து breast cancer. See, 3 cancers in women தான் வந்து நீங்கள் மைண்டில் ரொம்ப இம்பார்ட்டண்ட்டாக வச்சுக்கணும். ஒன்று breast cancer, ஒன்று cervical cancer, for which you will be taking the vaccine, and of course you will have to do yearly pap smears. Pap smear testன்றது வந்து உங்கள் யூட்ரஸோட வாய், that is if this is your, let's say your uterus, this is the mouth of the uterus, ஒரு சின்ன swab மட்டும் எடுத்து டெஸ்டிங் அனுப்புவாங்க to see if the cells are abnormal or not. Simple thing, or OP க்கு போனீங்கன்னா gynecologist should be able to do in a couple of minutes and send you back. So every yearly இது பண்ணுங்க. 3 consecutive years வந்து report normal-ஆ இருந்தால் the doctor will ask you to come every 3 yearly. Anyone who is sexually active should have this done. So that is about, ஏன்னா இதெல்லாம் வந்து earlier detect பண்ணக்கூடிய cancers. இந்த மாதிரி simple test பண்ணிங்கனாவே it's enough. Another thing is breast cancer, the second cancer. So breast cancer என்றது வந்து if you have a family history, if you're very obese, if you had an early age of menarche, age attend பண்ணது ரொம்ப early, ரொம்ப late menopause, children இல்லை, breastfeed பண்ணல, அந்த மாதிரினா உங்களோட estrogen exposure ரொம்ப ஹையாக இருக்கும். So you're more prone to developing a breast cancer. There is a very simple way in which you can find the first few symptoms of a breast cancer. நீங்கள் every month once after your cycle, maybe 3 to 4 days after your cycle வந்து you can go stand in front of a mirror with no top or a brassiere, and you can lift your hands above the head like this, and ஒரு finger, ஒரு palm, not the palm, ஒரு hand வச்சுட்டு apply some jelly or some moisturizing lotion and start palpating your breast in front of a mirror. So palpate பண்ணுறது வந்து slowly touch பண்ணி பாருங்க, move in a clockwise direction, move in an anti-clockwise direction, up to down, down to up, ஒரு wedge movement மாதிரி. இதெல்லாம் பண்ணி பார்த்துட்டு if you feel ஏதாவது ஹார்டாக உங்களுக்கு lumps மாதிரி தெரியுதுன்னா please go to a doctor. Other things that you can look for is any abnormality in the skin of the breast. அந்த orange peel மாதிரி sometimes puckering இருக்கலாம், or nipple discharge ஏதாவது abnormal-ஆக இருக்குது அந்த மாதிரிலாம், or if your nipple itself has bleeding, or anything of that sort, if you feel or a breast is smaller than the other, recently that's something you have noticed, all this point out to a high risk. So kandipa poi doctor kitta parunga, or simple ultrasound breast da, and mammogram again is advised if you're at a high risk of developing a breast carcinoma. So the third cancer is endometrial cancer. Endometrial uterine cancer. So any abnormal bleeding, the doctor will probably do a simple DNC in solvona, cleaning the uterus and send the materials for the examination. And also ovarian cancer. For ovarian cancer, again, it has a very delayed diagnosis because ovary, some people even or 5-6 months pregnancy அளவுக்கு அந்த cancer or the cyst மாறினதுக்கு அப்புறம் தான் உங்களுக்கு தெரியும் ஏதோ ஒரு bloating இருக்கே அப்படின்னு சொல்லிட்டு வரும்போது it is probably this big ovarian mass. So there is a reason we always tell இந்த மாதிரி things எல்லாம் sometimes earlier உங்களால diagnose பண்ண முடியாது. So every yearly mandatory health check, especially women, இந்த மாதிரி diseasesலாம் உங்களால முன்னாடியே கண்டுபிடிக்க முடியும். For that reason, please have a yearly check. And again, make sure your thyroid, your prolactin, everything is within normal limits. Now coming to lifestyle modification. So lifestyle modification நிறைய நீங்கள் கேள்விப்பட்டிருப்பீங்க. It's and of course the food over there உங்களுக்கு நிறைய options இருக்கும் than the Indian version of all these foods. So take a plate. A simple thing is divided into 2. ஒரு halfல fill it with vegetables. இன்னொரு half again divided into 2. And 1/4 of that half should be filled with carbs and 1/4 should be filled with protein. So keep this as your benchmark during every meal and you're good to go. And again, exercise both cardio and weight training is very important, not just cardio every day. Or 3 days cardio panna, 2 to 3 days weight training pannunga. The recommended amount of exercise is as little as 30 minutes a day for 5 days a week, just 150 minutes mattumda per week. But of course, that is at the minimum. You can step it up once you're comfortable. And acne, a lot of people come up with acne. So acne ku nariya reasons irukku, a lot of bacteria collection, stress, abnormal hormones, oily skin, PCOD, idellame it causes acne. So keep your skin very clean and use a nice non-comedogenic moisturizer and a face wash. Don't pluck your pimple, again that leads to excessive scarring. And I want to talk a little bit about sleep as well. Sleep, there are 3 stages of sleep: light, deep, and rapid eye movement sleep. So for light sleep, now you're sleeping, someone comes and switches on the light, or someone calls you by name, you'll wake up. And deep sleep, now where you actually go into a deeper sleep. And rapid eye movement sleep is when you get dreams or nightmares. So oru night pathina in the 3 stages oru rotation la nadandute irukum. There are a lot of methods in which you can have an increased deep sleep and less of the other 2. So some simple tips is that always have a fixed sleep time and waking up time. Or half an hour buffer is okay, but don't go to erratic timings. You know, unplug from electronic devices. These days we have so many things to look at, especially after putting the kids to sleep. You end up with the phone, you look at a lot of things, probably catch up on your series, or just scroll through social media. But or 4 hours before sleep at least you stop panningena unga brain waves ella vandu konja settle aga aramikkum, and you may end up with a good quality of sleep. And also dim the lights before sleep. Have a very fixed routine before you sleep. Every day brush pannittu put your pyjamas and maybe read a book or something. In the mari or routine panningna your body, once you start brushing, your body knows okay, so now it's sleep time. So it is easier for you to fall asleep. And make your bedroom, optimize your bedroom for a good sleep. AC or whatever you're comfortable with, potukonga, calming scents, all these help. So when you wake up feeling quite fresh, energized, clear-headed, you're able to think clearly, it means that you've rested quite well. Keep that as a benchmark, and if you do not get good sleep, please try to come into this routine. So these are small simple tips about the physical health. Now the mental health. See, especially in India, mental health is still considered a stigma, and I am someone who really wants to break it. A lot of things are considered stigma. If you do not have a child after marriage, if you're divorced, or so many things for that matter, everything is stigmatized. See, ultimately nothing tells about you, all these things. I don't think anyone should measure your quality or your character by trying to fit into society's impossible standards. So nariya positive affirmations kudunga body ku, talk to yourself. You are strong, you are beautiful inside out, and it's very difficult to balance family life and personal life and your work balance, maintain pandadla. It's very difficult, especially for a woman. But now the world is moving towards gender equality. So try to have your partners also involved in all this. And please take time for yourself. Whether you're someone who just got married, or you have a lot of time in your hands, or if you've just given birth to a child, or your children are going to college, whatever the scenario be, please give yourself the time to recover. Please give yourself the time to rest. Your time, girls' time, is very much therapeutic. And self-love, again, put yourself first before anybody else. And if ever ungalku edavadhu difficulty irukuna, I'm sure you'll find a lot of therapists. And it's not necessarily that or therapist kitta poi nama pesrom and it didn't work out, you shouldn't be like, okay, so this is therapy is not going to work for me, abdi kadiyadu. Some people even change up to 7 to 8 therapists before finding the right one. So talk to a therapist if you have any issues, anything. Don't struggle, because as I said, physical health endha alavukku important, andha alavukku mental health is also very important. So that is about mental health, and the last thing is a couple of lines about social health. Social health inradhu vandhu is just concern for others. Avladhaan. See how you become part of different communities and how well you get adapted to different communities is social health. So இப்போ ஒரு self identity create பண்றது வந்து it will boost up your social health because people tend to recognize you, and you can volunteer at events, you can develop new hobbies like reading, writing, painting and the மாதிரி எல்லாம். So and you have a lot of platforms these days to actually help you expand your social networking. So that is all about health. So I hope this session was helpful in some way. So as I said, 3 things: physical, mental and social, but out of which I believe that mental health is the most important, and I'm still trying to help women realize that, especially in India. And if there's anything, I'm always available. I'm also present in the social networking sites in Instagram under the name of Dr. Suganya B. You can keep in touch with me. I would love to listen to what you have to say. So as I said, take time to fully, wholly love yourselves, top to bottom and inside and out. You are beautiful no matter what the world tells you. Never ever ever judge anyone, or do not ever quantify or qualify yourself based on color or the texture of your skin for that matter. So thank you so much for this lovely opportunity again. So I just hope this was helpful.